All right, Chapter 60, Assessment of the Skin. Assessment of the integumentary function. The skin is the largest organ of the body. Its functions are to protect, sensation, fluid balance, temperature regulations. The anatomical structure of the skin includes the epidermis, the dermis, and the subcutaneous. Normal agents of the skin includes thinning of the skin, uneven pigmentations, wrinkling skin folds, and decreased elasticity. Dry skin, diminished hair, increased fragility, and increased potential of injury, reduced healing abilities. Aging is in the hands and other parts of the body. Question number one. What should be considered a normal finding in the skin assessment of an older adult? A. Elastic skin. B. Uneven pigmentation. C. Cherry angiomas. Or D. Petechiae. The answer is B. Uneven pigmentation. The assessment of the skin. First, what I would like for you all to do is prepare the patient, explain the purpose and what you're doing, provide privacy and coverings, assessment questions, inspect the entire body including the mucosa, the scalp, hair, and the nails, the general appearance, the color, the temperature, moisture, texture, assess for any lesions, palpate and measure, note any hair distributions, photograph anything that you think is abnormal. Photographs may be used to document nature or extent of skin conditions and document progress resulting from treatment. The skin appearance. The skin may appear to be erythema. It may have rash, cyanosis, jaundice, and pruritus. Pruritus means itching. Cyanosis. Cyanosis may be found in the fingertips, around the mouth, in the eyes, in the palm of the hands, and inside of the mouth. Cyanosis is the discoloration or the blueness of the skin. Patients may also be jaundiced. Jaundice may be found in the skin and in the eyes. The eyes may be yellow and jaundice means yellow. Cyanosis means blue. Assessing skin lesions. They may vary in size, shape, and the causes may be varied. The type and the appearance, the primary lesion, the initial lesions, the characteristics of the disease process. Secondary lesions results from changes in primary lesions, which could be scratching, trauma, infections, and wound healing. So make sure that you know what are primary lesions and what are secondary lesions. Primary skin lesions are macular patches, papular plaque, vesicular and wales. So make sure that you know what are the different primary skin lesions. Primary skin lesions also include nodules or tumors, cysts, and pustula. Those are primary skin lesions. Secondary skin lesions are erosions, scar, ulcer, or keloids. And please remember that keloids are mostly found in African Americans, especially around the ears and the face. And the keloids is the large indentations or bumps that's found either behind the ears, and it's usually after an African American has had either punctures or piercings or cuts or scars in the face. And a lot of times the keloids will need to be treated with steroids. Secondary skin lesion, fissures, scales, and atrophy. Those are secondary skin lesions. Secondary skin lesions also include crust and lichenification. Those are secondary skin lesions. Vascular skin lesions includes petechiae, and petechiae might be little red bumps that you might find, especially if a patient has a low platelet count that appears to be bruising. Spider angioma, that could come from aging, and ecchymosis, that can come from bruising. Vascular skin lesions also includes venous star, cherry angiomas. Skin lesions may appear on the bottoms, the legs, the abdomen, and the back of the arms. Question number 2. Which of these would be considered a primary macular skin lesion? A. Hives, B. Impetigo, C. Port wine stains, or D. Psoriasis? You got it right. The answer is C, port wine stains. Documenting skin lesions. When you are documenting skin lesions, make sure that you document the color, redness, is there heat, is it painful, does it swell, size and location, patterns of eruption, distribution of the lesion. Question number 3. Which can cause hyperpigmentation of the skin? Is it A, eczema, B, fungal infection, C, sun injury, or D, vitiligo? The question is C, sun injury. Hyperpigmentation can be a result of sun injury. Hypopigmentation may be caused by fungal infection, eczema, or vitiligo. The consequences of systemic disease: diabetes and diabetic neuropathy, stasis dermatitis, that can be found in the leg and the foot, HIV, skin infections such as bacterial, fungal, or dermatite, nails and hair. The nails may have a configuration, color, consistency. They may have view lines, ridging, hypertrophy, pitted surfaces, and spooning. Clubbing. Hair. The color, texture, and distribution needs to be noted when documenting. Albinism or albino hair loss should be documented. The diagnostics to determine if a patient has a skin problem may be skin biopsies, patch testing, skin scrapings, Zinnac smear, wood-like examination, and a lot of these examinations go along with the disease process. Question number 4. Is the following statement true or false? Zinnac smear is a test used to examine cells from blistering skin conditions. You're right, true. Zinnac smear is a test used to examine cells from blistering skin conditions. If you have any questions about Chapter 60, let me know. Please read Chapter 60 very carefully, as you will need to know the different types of skin. Make sure you know your dermis, epidermis, and your subcutaneous parts of the skin. Make sure that you know your primary and your secondary lesions. Okay, chapter number 61, the management of patients with dermatological disorders. The care of patients with skin conditions. Number 1, objectives of therapy are to prevent additional damage, prevent secondary infections, reverse inflammatory processes, and relieve symptoms. Nursing care includes administration of topical and systemic medications, wound care and dressings, and providing patients with good patient hygiene. Nursing management includes obtaining a health history, direct observation, complete physical assessment, and educating on self-care. So remember, when we are talking about skin conditions, we want to talk about subjective information, objective information, and a good physical assessment. The care of a patient with skin conditions. Number 2, nursing goals include maintenance of skin integrity, relief of discomfort, promotion of restful sleep, self-acceptance, knowledge about the skin care, and avoidance of complications. Pruritus. Pruritus is one of the skin disorders that we will discuss today. Most common symptoms of dermatological disorders is pruritus. May be first indication of an internal disease such as diabetes, blood disorders, and even cancer. The causes. Causes for pruritus may be medications, aspirin, antibiotics, hormones, and opioids. Remember, if a patient is having an allergic reaction to a medication, they may develop pruritus. Soaps and chemicals, radiation therapy, and prickly heat may cause pruritus. Psychological factors may cause pruritus. Patients are getting a little nervous. You see them breaking out. That's called pruritus. Care of a patient with pruritus. Reinforce prescribed therapeutic regimen. Educate on self-care. Use tepid water for bath. Avoid rubbing vigorously with a towel. Lubricate skin after bathing. Avoid situations that cause vasodilation. Overly warm environments and ingestions of alcohol, hot foods, and liquids. So sometimes children may develop pruritus, adults may develop pruritus. We want to make sure that we do not aggravate the situation. Infectious disease of the skin. Infectious disease of the skin may be bacterial, viral, or fungal. Bacterial infections include impetigo, folliculitis, fornicles, and carbonicles. Viral infections are herpes zoster, herpes simplex, and genital herpes. Fungal infections may include tinea pedis, which is when you have itching around your feet, tinea corpus, tinea capitis, and a lot of times that may be itching in your hair and in your caps, and tinea unguiculum. And a lot of times you may find this in men. Men may have the tinea pedis, which is also called what? That's right, athlete feet. And you also may see the tinea capitis in babies. That's called, some people call it cradle cap. Impetigo. Impetigo is crusty and it can be found around the nose areas. Herpes zosters. Herpes zosters that is found in adults is called what? That is correct, shingles. It can be found around the eyes and the dermatome in the adults, and especially in the elderly adults. And that's why we advise them to take the shots for shingles. Patient education, bacterial infection. Impetigo. Impetigo is contagious and it may spread to other parts of the body. Patients' education regarding antibiotics, hygiene, and skin, and the care of their lesions. Don't share towels, combs, and things of that nature. Bathe daily with antibacterial soap. Boils and pimples should never be squeezed. Boils and pimples, if they're squeezed, they can get worse, they can get larger, so make sure that you teach your patients how to take care of those type of bacterial infections. You don't want them spreading to other parts of the body. Patient education with viral infections, herpes zosters. Instructions. Make sure the patients have the instructions on how to take care of the herpes zoster. Prescribe antiviral medications, lesion care, dressings, and hand hygiene. Herpes simplex. Instructions regarding herpes simplex. Prescribe antiviral medications. Also, we may use prophylactic medications. Instructions regarding the spread of herpes and measures to reduce the contingent of partners or in neonates born to mothers with genital herpes. Patient education and fungal infections. Instruct regarding medications used, oral, topical agents, and some shampoos. These are fungal infections. Instructions regarding hygiene, use clean towels, and washcloths every day. Do not share your towels, do not share combs, and so on. Keep skin and folds and feet dry. Wear clean, dry cotton clothing, including underwear and socks. Avoid sympathetic underwear or synthetic underwear, tight-fitting garments, wet bathing suits, and plastic shoes. Avoid excessive heat and humidity. Hair loss associated with tinea capitis is temporary. So remember, if you have a little one who has cradle cap, a tinea capitis, then they may lose the hair, but that is just temporary. And also, make sure if you're teaching a patient about tinea pedis, which is athletic feet, make sure that you tell them, always put your socks on before you put your underwear on. Now, Dr. Dumas, why would you say that? Because if you have that fungus in your toes, and when you're pulling up your underwear, you pull the fungus up your legs into your crotch. And what do we call that? You got it, jock itch. So always put your socks on first and then have them pull the underwear. Parasitic skin infections such as lice. Pediculus capitis, pediculus corpus, lice. Also scabies or mites. And you may find this in the hand area of the patient. Patient education on pediculus capitis. Head lice may infest anyone, areas not a sign of uncleanliness. Instructions in the use of shampoos such as Quail or Rid. These are some of the shampoos that you may see the patients use who have lice. Combing the hair with a fine-tooth comb dipped in vinegar to remove the nits. So make sure you want to remove the nits from the hair. Note, may have toxic effects and may be used only as directed, and that's landing. All articles of clothing and bedding should be disinfected. Wash in hot water and dry clean. Furniture and floors should be frequently vacuumed. Do not share combs, hats, and so on, as lice can spread from one person to the other. All family members and close contacts must be treated for lice. Patient education, pediculus corpus and pubis. Pediculus corpus is a disease related to poor hygiene and of those who live in close quarters, such as prisons and sometimes even like nursing homes, things that causes close quarters. Pediculus pubis is common spread chiefly by sexual contact. Bathe in soap and water. Apply prescription medications over the counter such as Nix. If eyelashes are involved, make sure you put Vaseline. Maybe apply twice a day for up to 8 days. And you can also mechanically remove some of the nits with fine-tooth combs. All family members and sexual contacts must be treated for the infestation of and instructed regarding the personal hygiene. All clothing and bedding needs to be disinfected. Patients and partners should also be included in a scheduled checkup to assess coexisting sexuality and transmitted disease. Patient education in scabies. Mites frequently involve fingers, hand contacts, and the infection may spread. Healthcare personnel should wear gloves and providing care until infection is ruled out. Instruct patients to take a warm, soapy bath, allow skin to cool, and apply prescription medications. Contamination 5% to the entire body, not including the face, scalp, and leave on for 12 to 24 hours. Wash clothing and bedding in hot water and dry in a very hot dryer. Treat all contacts as the same as if they were contagious. Repeat the treatment in 1 week to prevent reinfestation. Pruritus may continue to be severe in weeks to come. Does not mean the treatment is not required. Question number 1. Is the following statement true or false? Application of scabicide immediately after bathing and before the skin dries and cools increases percutaneous absorption of the scabicide and its potential for central nervous system abnormalities. Is that true or is that false? You got it. It's true. Psoriasis. Psoriasis is a chronic autoimmune inflammatory disease of the skin in which the epidermal cells are produced at an abnormally rapid rate. It affects about 3.2% of Americans, prevalent in Caucasians. Median age is 28. Periods of remission and exacerbations throughout the life may be aggravated by stress, trauma, seasonal, and hormonal changes. Treatments are bathing to remove the scales and medications. Psoriasis. Psoriasis can be found on your knees and on your elbows and on the lower part of your arms. Medical management for psoriasis. The goal is to slow the rapid turn of epidermis, promote resolution to psoriatic skin lesions, control disease cycles, remove the scales. During bathing, using a soft towel, apply an emollient cream after maintaining routine. Pharmacological therapies may include topical, phototherapy, and or systemic. The nursing process to care for patients with psoriasis. The assessments, appearances of the skin, classic plaque-type lesions, assess nail and scalp involvement, coping with the patients with conditions. Note, it impacts the disease of patients' activities and interactions with other people. And sometimes your patients may be a little nervous about being around people if they have active psoriasis. The nursing process. The care of a patient with psoriasis. The nursing diagnosis that you may see is and are deficient knowledge, impaired skin integrity, disturbed body image, collaborative problem and potential of complications, infections, and psoriatic arthritis. The nursing process, the care of patients with psoriasis planning. The major goals may include increased understanding of psoriasis, end of the treatment regimen, achievement of smoother skin with control of the lesions, development of self-acceptance, absence of complications. The interventions, patient education regarding disease is necessary. Skin care and treatment regimen. Measures to prevent skin injury, avoid picking and or scratching. Measures to prevent skin dryness, the use of emollients, avoid excessive washing, and the use of warm, not hot water, but pat dry. The use of therapeutic relationship for support and or coping. Blistering diseases, bacterial fungal infections, allergic contact interactions, burns, metabolic disorders, IgG, autoimmune reactions. Blisterings, the care of the patients with blistering disease assessments, appearance of the skin, monitor vital signs frequently, assess for signs and symptoms of infection, pain, pruritus, and discomfort. Coping of the patient's conditions, note, impact of disease on patients' activities and interactions. Nursing process, the care of patients with blistering disease assessment. Appearances of the skin, monitor vital signs frequently, assess for the signs and symptoms of the infection. Pain, pruritus, and discomfort. Coping with the patients with conditions, note impact of disease on the patient's activities and their interactions. The nursing process includes acute pain, skin and oral cavity, impaired skin integrity, disturbed body image, risk for infection, deficient fluid volume due to loss of tissue fluids. Nursing process of care of the patients with blistering disease. The planning is major goals may include relief of oral pain, enhancing skin integrity and relieving discomfort, promote positive body image, prevent infections, promoting fluid balance. The interventions, meticulous oral hygiene is needed. Avoid commercial mouthwashes. Keep the lips moist and lip balm, petroleum and or linoleum. Cool mist humidified air. Use cool wet dressings or bathe hygiene measures. Apply powder liberally to keep skin from adhering to the sheets. Monitor for and prevent hypothermia. Skin care may be similar to that of a patient with extensive burns. Measures to prevent secondary infections. Encourage adequate fluid and nutritional intake. The nursing process, the care of patients with toxic epidermal necrosis or Stevens-Johnson syndrome. The assessments are skin inspection of the oral cavity, vital signs, fever, respiratory status, tachycardia, fatigue, pain levels should be documented, noted, and assessed. Urine volume, specific gravity, color monitored, local signs and symptoms of infection in the IV sites, daily weights, evaluate for anxiety and or coping mechanisms. The Stevens-Johnson syndrome diagnosis: impaired skin integrity, oral eye and skin, deficient fluid volume, electrolyte losses related to losses of fluids from denuded skin, risk for imbalanced body temperature, acute pain related to denuded skin, anxieties related to the physical appearance of the skin and the prognosis. Collaborative problems and potential complications. Number 1, sepsis, conjunctival retraction, scars, and corneal lesions. Intervention number 3, maintaining skin and mucosal membrane integrity, attaining fluid balance, preventing hypothermia, relieving pain, prevent infection, consider reverse isolation, reducing anxieties, monitoring and managing potential complications, promoting home and community-based care. Skin cancers. The most common cancer is skin cancer, frequently related to sun exposure and prevention, use of sunscreen and avoid sun exposure. So make sure, guys, that your patients know the different types of sunscreen. Make sure they know the different levels and numbers. Now, most of the time you will have to do patient education when we're talking about sunscreen. Patients who are darker colored may think, hey, I don't need sunscreen, I don't tan, but that is quite not the truth. You need to make sure that you teach your patients it does not matter their skin color, they will still tan. And sometimes patients who have fair skin, such as the red hair and the blue eyes, more Irish type color skin complexions, they're easy to burn or they develop freckles. So make sure that you teach how the patients need to decrease the amount of sun exposure and decrease their risk for skin cancer. Skin inspection is very important. Make sure you inspect the skin very well. Inspect any lesions that you may not recognize. Also make sure that you know the ABCD border documentation for skin. Prevention of all types of skin cancers involve protections from excessive sun exposures, and tanning is very important. Basal cell carcinoma, also known as BCC, most prevalent, rarely causes of death, appears on sun-exposed hands, face, neck, and scalp. There are small waxy nodules, may appear shiny, flat, gray, yellow, rarely metastasize. Reoccurrences are common. Squamous cell carcinoma, also named as SCC, arises from the epidermis, sun-damaged skin, less aggressive than melanoma, and can cause death. May metastasize by blood or lymph. Rough, thickened, scaly tumors may be asymptomatic or bleed. Border is wide, more infiltrated, more inflammatory. Basal cell carcinoma. Make sure that when you are assessing a patient that you look at their ears, the nose, and areas that's highly susceptible to skin exposure. The treatment for BCC and SCC is medical management, eradicate the tumor. Treatment depends on location, type, and the depth. Alternate radiation, photodynamic, topical chemotherapy creams. Sometimes the patient may have to have surgery. Surgical incisions, Mohs myographic surgery, electrosurgery, and cryosurgery. Melanoma. Number 1. Cancerous neoplasm presents in the dermis and in the epidermis. Look at chart 61-4 in your book. Manifests as a change in the nevus. And do you know what a nevus is? A nevus is a place or mole on the body. When you have more than one, it's called a nevi. Or a new growth of the skin. Color is dark red, blue in color, or is mixed. They may have an irregular shape. So remember your ABCD when you're documenting what the shapes and size of different types of lesions. Itching, rapid growth, ulceration, and bleeding may occur. Treatment and surgical excision and chemotherapy. The melanoma. You see this melanoma here is 1 cm, and the melanoma on the right is also 1 cm. But note the size, one is flat, one is raised. Question number 2. When assessing a patient's skin for possible melanoma, what type of lesion would be of most concern as a potential melanoma? Is it A, small papula with dry and rough scales, B, a firm nodular lesion topped with crust, C, a pearly papula with a central crater and a waxy border, or D, an irregular shaped lesion? You're correct. The answer is D, an irregular shaped lesion. Kaposi sarcoma. Kaposi sarcoma is a malignancy of the endothelial cells that line the blood vessels. It's dark reddish purple lesion of the skin. It can be found in the oral tract, the GI tract, and the lungs. The classic Kaposi sarcoma are found in men, older men in the Mediterranean or Jewish chronic benign. Endemic African Kaposi sarcoma, eastern half of Africa men resembles this classic. Iatrogenic organ transplants associated with Kaposi sarcoma organs, transplant patients, and immunosuppressant patients. Also, patients who have AIDS related or epidemic occurs with AIDS are aggressive, and the cancer known in the HIV population is called Kaposi sarcoma. The care of a patient with melanoma assessment. Inspect the skin carefully. Ask specific questions about pruritus, tenderness, and pain. Changes in moles and or new pigmented lesions. Assess knowledge level of the risk factors. Assess coping and anxieties. Refer to the figures in 61-5 and 61-6 in your book. The care of patients with melanoma diagnosis, acute pain, anxiety, depression, and deficient knowledge. Collaborative problem and potential complications. Number 2, metastasis, infections of surgical site. Nursing process, the care of a patient with melanoma and planning. Major goals may include relief of pain discomfort, reduce anxieties and depression, increase knowledge of the early signs of melanoma, and the absence of complications. Interventions. Number 4, pain provided appropriate analgesics and measures to promote comfort. Provide emotional support, allow patients to express feelings, clarify misconceptions, and supply information supporting cope and involve family in discussions. Dermatological and reconstructive surgeries, skin grafts, autografts, allografts. What is autografts? What is allografts? What is xenografts? Split thickness and full thickness. Make sure that you know what is autografts, allografts, and xenografts. Pedicle flaps and free flaps. Chemical face peels. Dermabrasion. Facial reconstruction surgery and or facelifts. Laser treatment of lesions. Carbon dioxide lasers. Pulse dye lasers. Pulsed ER YAG laser. Nursing management. The majority performed is outpatient. Most care is in the home. It's a short recovery. Prepare patient and family for what to expect post-op. Look at table 61-6. Is the following statement true or false? Facelift is a surgical procedure to remove soft tissue folds and minimize cutaneous wrinkles on the hands. Is that true or false? The answer is false. The facelift is a surgical procedure that removes soft tissue folds and minimizes cutaneous wrinkles on the face, not the hands. If you have any questions about the lecture, chapter 60 and 61, please feel free to put them in the discussion board. This is the lecture for chapter 60 and 61, the subcutaneous integumentary lecture. Thank you guys.